Well, my first experience with afibrillation was the night before my fourth son's wedding. I had 50 people here for dinner, and everybody was enjoying themselves, and went home relatively late. And I went to bed and awakened at 2 a.m. with my heart pounding away, not aware of what was happening to me. And my son was sleeping here, and I went down and awakened him. He was a resident at that time, and he panicked, and off he took me to the hospital. I have to be honest and say I think I was naive, and because I was told when I was hospitalized that this could be a one-time episode. And I just thought, well, okay, I'll just go about my business. But as it turned out, it was not a one-time episode. And I did have, over the years, repeated AFib attacks. I did not feel, and maybe I was not facing reality, that this could happen to me also, becoming a stroke patient. I'm aware of what may trigger it, and I don't dwell on it. And I just conduct my life and do what I have to do on a daily basis.
You have recently been diagnosed with atrial fibrillation. Atrial fibrillation is an abnormal heartbeat or heart rhythm that may be with you all the time, continuously, or may occur in episodes that last minutes to hours. Many people with this problem experience fatigue, fluttering or pounding sensations in the chest, dizziness, or shortness of breath. Or you can feel perfectly well. Either way, atrial fibrillation can lead to serious problems. One serious problem is a stroke. 1 in 6 strokes is caused by atrial fibrillation. An atrial fibrillation-related stroke can be particularly severe and disabling. So help beat your odds of having a stroke, learn about atrial fibrillation, and receive proper treatment. How might atrial fibrillation cause a stroke? In atrial fibrillation, the 2 upper chambers of the heart, the atria, fibrillate or quiver. As a result, blood moves more slowly through these chambers. The blood can pool and potentially form a clot. The blood clot can break away, travel from the heart to the brain, interrupt the flow of blood and oxygen, and injure part of the brain. In other words, cause a stroke, potentially leaving you with permanent health problems, such as weakness of an arm or leg, difficulty walking, trouble speaking, even death. What can you do to help prevent a stroke? Your healthcare provider will work with you to treat your atrial fibrillation symptoms and help prevent a stroke. For atrial fibrillation, you may take medication to slow the heart or to restore the heart rhythm to normal. In order to help prevent a stroke, your healthcare provider will likely prescribe medicine to thin the blood, either aspirin or an anticoagulant. Anticoagulants require regular monitoring by a healthcare provider. There are things you can do to reduce your risk of atrial fibrillation-related stroke. Talk to your healthcare provider to learn what options are right for you. To become more educated about how to help prevent a stroke, consider asking your healthcare provider questions like, based on my atrial fibrillation diagnosis and medical history, what is my risk for having a stroke? Are we doing all the proper things to reduce my risk? What are the treatment options? Are there lifestyle changes I can make? Will any of my medications interact with the medications for atrial fibrillation? Hopefully, you will never have a stroke, but you should be familiar with the common symptoms and how to quickly respond if you or someone else has stroke symptoms. Learn the FAST test, which helps you remember the common signs of a stroke. If you ever notice one of these signs, it's important to call 911. For more information about stroke signs and symptoms, look in your patient education toolkit or visit www.stroke.org. Together with your healthcare provider, you can help beat your odds of having an atrial fibrillation-related stroke by being informed and being properly treated.